and Multiple Innovation Center, and we are investing significantly in R&D, so to ensure that we also become globally competitive. And there are several new initiatives we have started, including the upcoming areas like genomics and proteomics, which is making a big impact in the in vitro diagnostic area. So we have made a big investment on that in our IIT Innovation Center. And we are also got some original patent. We have done between LV Prasad Eye Institute, Trivitron, and IIT Madras. We have actually got the first patent for a public access retinopathy screening device. So there's been a significant investment in innovation. So in conclusion, what we feel is India can be the global medtech hub like pharma with the right ecosystem. So if only government start recognizing medtech as a separate fourth pillar on healthcare segment and start doing the right things. For example, we have problems like inverse duty structure. When you are importing a finished products, you pay less customs duty compared to getting raw materials and components. So there are several problems we as an industry is facing, since we don't have a nodal ministry, we don't have a department of pharmaceutical like most of you do in pharma industry. We are actually struggling to get our facts together. There are 700 small size manufacturers in this country, but they are not being nurtured and supported properly. So that makes our industry 80% import dependent. So hopefully with all your support and guidance from the pharma industry, which we consider as a big brother, we probably can also ensure medtech also gets the relevance and also the support from the government and the industry and corporate leaders. And single specialty healthcare services, which is again another area which I focus through Metropolis, Maxivision, and Apollo White Dental and all of them. We hope they have a unique relevance owing to economies of scale. No one wants to go to a dental treatment or eye treatment or pathology test into a tertiary care hospital. Tertiary care should focus on tertiary care, and the primary and secondary care should be through the single specialty hospital. That's a good model to ensure that hospitals are not wasting their time doing basic things. So this is purely an economies of scale situation. So if the single specialty has a big relevance, and that will grow substantially in the years to come. So the innovation in these areas will help achieve health security for all. When we can all talk about food security, I'm sure we should talk about health security. And for that, now all the four pillars of healthcare should grow together. That in conclusion is possible. And the pharma industry, we salute the pharma industry for what they have done. And today we are very proud when you go and talk about pharma industries of India. The IT and pharma has shown the world that we are globally competitive. So that's what Kalamji says, unless India stands up to the world, no one will respect us. In this world, fear has no place. Only strength respects strength. Thank you.
Thank you, Dr. Velu, for giving a wonderful insights of what the diagnostic industry is all about. Can you please accept a small token of appreciation, please? With this, ladies and gentlemen, we come to the end of the seminar for the 6th Annual Pharmaceutical Leadership Summit and Business Leadership Awards 2013. I made an exception for this particular program as I saw the pulse of the nation, and the establishment which we are presently running now is completely messed up. We don't have the proper direction where we are heading for. Although I am not biased to any other political party, but the person who has changed the political landscape in India, the man who the entire nation is finding out a solution for them, in every 5 minutes, 10 minutes, there are thousands of people going at his door for finding out a solution. At a time when Sharad Pawar, the Agriculture Minister of India, is telling that he cannot solve the onion prices, but he can make it. He is Arvind Kejriwal of Aam Aadmi Party. And the man who built Maharashtra's India Against Corruption movement was also part of the Right to Information Act, never had any political inclination, was forced into the political system because of the culture which we had, despite having the fact that Dr. Manmohan Singh gave a letter to Mr. Anna Hazare that he is going to bring out the Lokpal bill, but didn't happen. present Lokpal bill, what we have seen now is nothing but only protecting these ministers. These ministers will never go to the jail, which we are having it now. I don't want to go into the details of what happened there, but definitely Aam Aadmi Party is not supporting that one because it doesn't protect that. There is no autonomy of CBI. There is nothing left out there. Ladies and gentlemen, it's my proud privilege, and I am privileged to have with us Mr. Mayank Gandhi, National Executive Member of Aam Aadmi Party, to be the chief guest of the program. He is an Aam Aadmi among us. To be on the dais, please. Pleasure having you. And also, to light the lamp, I will invite the lady who took on the NCP and Sarad Pawar, Anjali Damania. Can you please come here, please? She is the one who is not scared of anything and has given her lifetime everything for it. Thank you for being here. Can you have the national anthem, please? Jai. Can we have the nomination video, please? Lights off. Yes, include. Not this, not this.
Ladies and gentlemen, hello and welcome to the 6th Annual Pharmaceutical Leadership Summit and Pharmaleaders Business Leadership Awards 2013, brought to you by Pharmaleaders, Asia's biggest and most analytical news media in healthcare communications. In an era where healthcare in India is the most neglected, as politicians and policymakers are busy scoring their political points, Pharmaleaders attempt to raise the uncomfortable questions ignored by other media houses, as we believe that healthcare is the key to the national development and India cannot be a mute spectator where policy reforms in healthcare has taken a backstage over political issues. We need reforms. We don't need false promises. The nation needs affordable medicines with quality care and not empty and unreasonable claims. India needs enough doctors, working public healthcare centers, nurses, and a robust policy, not just unrealistic and populist measures. We are sick of this. Ladies and gentlemen, Pharmaleaders believe that while the industry today is at loggerheads with the government and various statutory authorities, including the regulators, such as the Drug Administration, Market Watchdog, SEBI, and a host of other organizations, there is a lack of meaningful dialogue and interaction between the industry and the government, leading to the bigger uncertainty of the overseas players coming to India with a basket of products and investments in the absence of a weak law and virtual policy paralysis. The issue of pricing is the biggest factor leading to the discontentment of the pharma companies. The unavailability of medicines seen across the country is the major challenge, as well as the declining research and drug discovery. Clinical trials are seen as major deterrents. The Pharmaleaders platform therefore attempts to build these crucial gaps of trust deficit and infuse the sense of confidence of the country's drug makers, policy makers, and the government. Pharmaleaders is an independent media that aims to ventilate the views of the common man through its magazine and digital version. Pharmaleaders is India's first opinion-based and research-driven healthcare communication media and has a decade of relentless reporting in pharma journalism in an unbiased, fearless, and independent way. Over the last 1 decade, Pharmaleaders have covered some of the biggest voices in the healthcare industry. Announcing the nomination categories of Pharmaleaders Business Leadership Awards 2013, Satya Brahma.
Indian pharma industry is one of the robust sector, and I can proudly tell you, while I have covered more than 1,000 CEOs of the pharmaceutical companies.
Chairman and Editor-in-Chief of Pharmaleaders said, Pharmaleaders' attempt is to bring out the best of the companies and individuals who have been performing under tough conditions following global economic slowdown, pricing policy of the drugs, regulatory strict vigilance, and a host of other healthcare issues, while every care is taken to include the best companies based on their performances. Pharmaleaders do not make a mixed set of rules as per ranking, big or small, in size and revenues. It is innovations and trend setting that are the mantras of selection. Ladies and gentlemen, Incredible Pharmaleaders 2013, Pushing India's Growth Agenda, is the theme at the historic edition of the 6th Annual Pharmaceutical Leadership Summit and Pharmaleaders Business Leadership Awards 2013. Entering in its 6th year, the much anticipated and awaited prestigious title is attempting to revisit the current state of affairs and the pressure of building brands and, most importantly, maintaining a sustainable growth record in an era where government's policy-making machine making it a difficult task to the thinking process and the strategies to retain market dominance. As Pharmaleaders is discussing today the key issues that is grappling the industry, both domestic and international markets have been witnessing a change of approach. The price war, US FDA vigilance, FDI and generics are the key drivers that will determine the winning combinations. Indian pharmaceutical, rather healthcare landscape has drastically changed, paving the way for fresh and challenging pressures to the pharma leaders. The incredible journey of the pharma leaders, though marked by many ups and downs, the global healthcare industry are certainly not ignoring the meteoric rise of Indian pharma leaders. Pharma leaders believe that the real challenges of the pharma leaders in the present context are multi-dimensional, though the bigger issues grappling the minds of the leaders are increasing pressure from regulators, FDI, clinical trials, and of course, the pricing. Originally launched in 1999 as the Pharma Business and Technology Excellence Awards, the Excellence Awards were first produced for the first time in India by the Pharma Business and Technology magazine as a means of honoring innovation in pharmaceutical marketing, corporate governance, and research and development and lifetime achievements category. Pharma Excellence Awards were produced by Pharma Business and Technology Magazine Awards in India and expanded to recognize global corporate citizenship and individual achievements. Over the last 1 decade, Pharmaceutical Business Leadership Awards 2013 has been re-evaluated and recast to focus more on business scientific accomplishments in the biotech industry with a significant thrust in academic pharmaceutical research. The set of awards have been presented since the last 1 decade at a sold-out gala to over 500 industry executives and the leading academic scientists from around the world. Each award or nomination is being screened by the board members of Pharmaleaders Group consisting of the 5-member team and then further approved by Network 7 Media Group juries consisting of eminent members of the healthcare community. After thorough screening, the names of 5 nominees emerge out and are thrown out to public by email voting, then SMS voting followed by the final verdict of the jury members. The Pharmaleaders Awards demonstrates how companies can, through their core business activities, help achieve excellence in innovations. The 2013 award nominations has been given explicitly to companies delivering inclusive business models which are sustainable, commercially viable business initiatives that expand access for low-income people to goods and services or improve their livelihoods by engagement in value chains as direct employees, suppliers or distributors, while also generating sales and profit growth. By bringing together examples of innovative, effective business practices, the 6th Annual Pharmaceutical Leadership Awards will also provide leading businesses and